Hello, everybody, and thank you very much for joining us tonight. Welcome to tonight's Pharmacist Virtual Learning Experience by Mandel's Clinical Pharmacy. And as you can see on the screen right now, we have a little disclaimer that I'd like to read before we get started tonight. And that disclaimer is this. The Pharmacist Virtual Learning Experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to welcome you again to the Pharmacist Virtual Learning Experience. So basically, what is this program all about? We have an educational program that we have created at Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. Pharmacist takes place every Monday night at 7 p.m. Eastern Standard Time. Tonight, we will be providing a live medication instructional program on 3 popular fertility products, including an interactive Q&A throughout the program, where you can ask your own questions. We're joined by various amazing HCPs each week from across the nation to provide you with that real-world experience, just as if you were sitting across the table from them in the clinic tonight. Today, we are joined by Kaitlyn Endicott, and I want to say thank you very much for coming. You can join us on Zoom or Facebook Live. We invite you to be a part of the discussion by sharing your questions with Kaitlyn throughout the program. If you're on Zoom, you can type them right into the chat or the Q&A section on Facebook directly into the chat itself. And with all that being said, thank you again for your time and interest this evening. And I now want to turn it over to Kaitlyn. Take it away, Kaitlyn.
Thank you, Craig. Good evening, everyone. Thank you so much for joining us tonight. I hope everyone had a great Monday and start to their week. As Craig had mentioned previously, my name is Kaitlyn Endicott. I'm a fertility nurse in the Northern Virginia area. Tonight, we will be reviewing 3 different medications. First, we will review the Gonolf multi-use vial. That will be followed by the Gonolf pen, and then we will finish off the evening with the Centerra Patch. After reviewing how to do each of these medications with an instructional video, we'll have time for live Q&A sessions, so feel free to submit any questions as we go. If we pass one and then you think of a question later when we're on a different medication, you can always ask it at the end. That's perfectly fine, or even as we go. Just a reminder as well, happy to answer general questions about medications, but like Craig mentioned, ultimately any questions that are unique to your clinical situation or your dosing protocol, that will have to be deferred to your healthcare provider. Our goal tonight is to provide you with plenty of resources to help ease the process of IVF and the injections. I'm confident that after tonight, you will feel at ease with these products. Please keep in mind as well that these videos and the recording of this live stream session will be available to you at mymandelsPharmacy.com/pharmacist. So don't worry if you miss any of tonight's stream or you weren't able to write everything down. It'll be there for you to review in the future. So I think we are ready. Our first medication, like I said, is the Gonolf vial. So we are ready when you are, Craig. Vial. First, collect all of your supplies. So you will need your vial of medication. You will also need the pre-filled syringe that's full of saline or water. And you will also need one of the provided syringes. The medication will have a cap on it. It'll just pop off like this. You'll see the rubber stopper there. At this point, you can take your cap off of the pre-filled syringe. I recommend getting into the habit of taking an alcohol prep wipe to wipe off the rubber top of the vial. In order to compound the medication, you will just push your needle into the vial of medicine, inject all of the water into the vial. Once all of the water is in the vial, you can take out the syringe. It can go into your sharps container. And at this point, you have your medication reconstituted. Now you'll use this vial multiple times. So at this point, you can go ahead, take your syringe, peel it open. It peels open like a banana peel. And then at this point, I recommend pulling back on the plunger until you meet the dose that you're prescribed to by your provider. So for the sake of this video, we will use 150 units. So I pulled back 150 units of air and take off the cap, insert it into the rubber stopper, inject your air in, flip it over, and pull back to 150. If you get a little bit of air in the syringe, that's okay. You can push it back up and restart. So go back until you see 150. You can see I have it here. And then take out your needle. Now we want to go ahead and prep the site for injection. This is a subcutaneous injection, so pinching an inch of belly fat or pinching an inch of skin on the thigh are both appropriate areas for this injection. So once you've chosen your site, you will take an alcohol prep pad, clean the site off, let it dry, and then you will pinch that inch of skin and go in fast at 90 degrees like a dart. And then push the plunger, hold it for a few seconds, then take the needle out. You can get rid of the needle into your red sharps container, and you've completed the injection. Okay, so that was the Gonolf multi-use vial. Now, keep in mind it is multi-use, so be sure you don't throw that vial away after you've done just one injection. You want to save it until it's completely empty. It will likely get you multiple days out of that vial. Now, you've probably heard of this medication in a pen device form as well, and we'll be covering that next, so be sure to stay tuned for that. Any questions out there yet, Craig?
Yes, yeah, we actually just got, this question just came in on Facebook that says, what does Gonolf actually do to impact my cycle?
Yes, great question. Not only do we want to know how to do these meds, but we want to know why, right? So your Gonolf is actually stimulating the growth of follicles within an IVF cycle. So within your ovaries, there are follicles. Within follicles, there are eggs. So naturally, our bodies, each month, our brain chooses usually one dominant follicle for the month in a natural menstrual cycle. Instead of that, in this case, we are actually stimulating the growth of multiple follicles, multiple eggs within a cycle. So that's what the Gonolf is doing. It's just kind of overriding what our brain would normally do, and it's giving much more of that hormone that will result in many more follicles developing over the cycle compared to just one within a natural menstrual cycle. So of course our goal with this is to retrieve multiple eggs at the end of the cycle, right? Every IVF cycle, we're hoping that we're getting multiple eggs to fertilize. So that is what the Gonolf is doing for us. Good question.
Thank you, Kaitlyn, very much. I appreciate it. I know a lot of times these questions, like you said, it's always good for people to understand not only, what they're taking and how to take it, but why and what it's doing for them. And that can alleviate a lot of the nerves. So thank you for that awesome overview of what Gonolf is all about. So this question comes up quite often. I know you've actually answered this on the show before, but a lot of people are having some questions around overfill. So this has been coming in. It says, I'm a little concerned or confused about the overfill. I'm just not sure. How does that work to my advantage?
Yes, this is definitely a hot topic, and that's because with the overfill, you're actually getting more bang for your buck with the medication. So typically when your nurse orders your medications in quantities based on whatever dosage you were prescribed by your provider, they'll typically take into account, the amount that's on the label of the medication that they prescribed you. But with the overfill, there's more in there than what's on that front label. So you want to be sure that you are using every last drop out of that vial, even though if you were to do the math and, divide your dose by the amount of IUs that are in the vial, you probably have an idea of how many days that's going to last you. But with the overfill, you know that you'll get more out of that vial than whatever that, that day's allotment was that you calculated. So good rule of thumb, just continue to withdraw the medication from the vial until you're completely empty. There's nothing wrong with using every little last drop out of there. That's what it's there for. So I definitely recommend and tell my patients all the time to utilize that overfill.
Thank you very much, Kaitlyn. Yeah, that's great because we know a lot of times people think of it like when you fill a prescription of pills, right? And the pharmacist obviously doesn't say, "Here's a 5 extra just in case you
Right.
go over." So it's a little bit different because of the injection, and hopefully that answers any questions. And again, one thing we always like to bring up on the show, if you hear a question that actually makes you think of that answer, makes you think of another question, a follow-up, we will get back and allow, like at any point throughout the show, you can bring up questions, at the end about things that we talked about in the beginning. So just keep thinking about any questions that pop up as we go. Just like this one that just came in, just a basic storage question. It says, what is the safest way to store my medication in the house? How about when I'm traveling?
Great questions. For the multi-use Gonolf vial, prior to mixing the medication, you can store it one of two ways. So either at room temperature or in the refrigerator. Either way is fine as long as you haven't put the water into that powder yet. Once you have reconstituted it, or once you've mixed that saline into that powder, then you do need to store it in the refrigerator. Other good tips, just keeping it, out of the hands of maybe little ones or pets, things like that. So keeping it maybe towards the back of your refrigerator, or if you're keeping it at room temperature, up on the counter, things like that. If you are traveling with the medication, that's a common question as well. So if you have mixed that water with the powder and it needs to stay cool, I would surround it by ice packs or put it in like a small lunchbox, something like that. You do want to keep it at a refrigerated type temperature to make sure that medication stays good the appropriate amount of time that it should.
Awesome. And so that, as of right now, that is, we've kind of wrapped through the questions that we've gotten through. So as always, we like to give just, another 30 seconds or so. If you're thinking of a question and you haven't had time to get it in yet, we'll give you a little bit of time to get that in. And in the meantime, I will throw it back over to you, Kaitlyn.
Great. So I know I just kind of touched on how to store it, refrigerator versus room temperature, depending if it's been mixed or not. Keep in mind as well, as far as expiration dates and that sort of thing goes, that this medication is good for 28 days once it's been reconstituted. So the day that you put that water into the powder, you're on a 28-day time clock. Typically for an IVF cycle, you're going to have no problem using up what you have. Typically cycles aren't that long. So, but if for some reason, something happens with your cycle and it's delayed, canceled, life happens, then be sure to note what date you reconstituted that vial and be sure that if it's been past 28 days, you're probably no good at that point with that med. If it has not been reconstituted, so it's still just powder with your syringe of water, then it's good until the expiration date at that point. So just some things to remember.
Okay, so I think we have gotten through all the questions we have right now. So again, just if you think of any questions you're going to have another section in the next one that we're about to talk about to ask any kind of general questions. But in the meantime, I think we are ready to move on.
In order to inject the Gonolf Red Eject pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonolf pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So I always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, That's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen, so anywhere that you can pinch an inch of skin and the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15-30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. This. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you will actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your Gonolf pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the Gonolf pen. So you can see there's some small differences, of course, with that compared to the multi-use vial, mainly just that it comes in the pen device, has a couple of different supplies compared to the vial, but ultimately same medication, same route of injection, that subcutaneous fatty tissue type of injection, same needle size. So just two different ways to achieve the same goal. Now, one thing to mention as well with the pen, like I said in the video, when you're pressing this plunger, be sure to press it down hard. And I say that because the top of it kind of easily presses, but medication isn't actually being dispensed. Be sure to press it hard and watch those numbers turn. I've had many patients who thought they were giving themselves their dose, but they actually weren't because they weren't pressing hard enough. So just be sure, triple check yourself with pressing it hard and watching that window go down to 0. Okay. Any questions at this point, Craig?
Thanks for adding that too. That's great. It's really helpful. Some of those little things are the things that people maybe forget or don't know about, and it can go a long way to improving the process. And speaking of improving the process, here's a question. I'm surprised we actually got to the second medication before this came up, but this question came in on Zoom. How painful is the pen shot? Is there anything I can do for the pain if it is there?
Great question, and a very common one, like you said. So typically these subcutaneous injections, so that belly fatty tissue, sometimes you can do it in the thigh as well. Typically these aren't as painful as you think they're going to be. So some of my patients don't even feel it at all. Of course, right, there's only one way to find out. You have to give it a try, but just be confident in it. The faster you physically push the needle through the skin, the less you're going to feel it. So the more you do it, the more that you'll get in your habit of, kind of your routine of how you do it. And as you do it more and more, you'll get faster and faster with actually putting the needle into the skin, which helps. Now, some patients like to use ice and numb the area. That's an option. There's also numbing patches that you can purchase. I usually recommend for these subcutaneous injections trying it first before that. Typically, I save those numbing patches, which we'll get to next, for the intramuscular injections, but you can use them for this type of injection. But I usually say to give it a try. It's typically not nearly as bad as you think it's going to be, and the lead up to it is much worse than the actual injection most times. But great question.
Awesome. Thank you so much. And so this next question is just about a multi-shot situation here. So this comes up quite a bit, and I know we've talked about this on previous Pharmacists. And so the question is, I'm just a bit confused. What should I do if I don't have enough for my full shot? Do I add the remainder to tomorrow's shot and then return back to the normal schedule after that? B, inject whatever I have left as a partial shot and proceed as normal tomorrow? C, take 2 shots at once? Or D, is there something else that I'm not even sure about?
Great question, and a very, very common question that I get amongst my patients for sure. So a couple of different things you can do here. If you are looking at your Gonolf pen and you notice in this chamber, now mine's pretty full, but this gray plunger, it's made its way up to the top, and you know that you don't have enough in there for your full dose. You already know that, right? You have a few options. You can, if you don't even want to mess around with it and you want to discard that pen, you can do that. Open a new one, dial up your normal dose, give your shot like you would, and you're done. Now, that's a fine option if you want to go that route, but keep in mind that discarded medication is money in the trash, right? So if you want to utilize that every last little bit in your pen, it's called utilizing the overfill. So if you don't mind giving yourself 2 injections in the same day, then I definitely recommend doing this. What you'll do is you'll actually dial up to your normal dose on your pen, even though you know that there is not enough left in this pen to give you that full dose. That's okay. Still dial up. So let's say that my dose is 200. I know I don't have enough in there. From here, I just do what I would normally do. Put on my needle cap, clean off the skin, give the injection, push my plunger down, 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 but you're going to notice that the number in the window does not go to 0. And you're also going to notice that your plunger is flush with the top. There's no more liquid left in that in the chamber. Once you've reached that point, take out the pen, open up a new pen, and whatever number was left in the window on that old pen is what you will dial up on your new pen that you open. So you don't need to do math. The pen is going to do the math for you. So once you've dialed up the remainder in that new pen, same thing, needle cap, clean the site, give the injection. You don't need to wait. No, you don't need to waste time in between. Just do it back to back. That way you're getting, your normal dose at the normal time that you would get it. And then at that point, once you've done that, you just discard your empty pen and store that new one that you opened for the next day, and so on. Great question.
Awesome. Thank you for going through all those options and really explaining that, especially the part about money in the trash. I love that. It's a great way to look at it, because every single little bit of wasted medication, right? We want to make sure that nothing's being wasted. So that is an excellent way to look at it, and a great process to follow to make sure that you don't end up with money in the trash of your own. So here's an interesting question. I haven't heard this one asked this way before, but it's just, I guess from a presentation standpoint, somebody who said, they're confused or wondering why, if there's a reason why the nurse would have prescribed the pen instead of the vial. Is it a me issue? Is it my nurse issue? Or is it just kind of a coin flip?
So great question. There's typically no rhyme or reason why, you would prefer one or the other. It can be a nurse preference. It can be a patient preference if there's one that you like more than another. It can be a practice's preference as well. Maybe Mandel's is running a good deal on one over the other, So no rhyme or reason, at least for my patients. I'm fine with either one. I usually recommend kind of keeping it uniform though across the board. Whatever you start the cycle with, probably just easier to, if you need to refill and things like that, just to keep things the same so that you don't have any confusion. But ultimately, same med, just a different way to do it. It's a great question.
And there's always great deals in Mandel's, so you always find. Sorry, I just had to say that. I feel like I think I'm contractually obligated. No, but we will definitely take care of you and make sure that we find what's best for you and at the best possible cost to make sure that you can go through this and you don't end up with money in the trash at all. So wrapping it all up there again. One quick thing: we're out of questions coming in for us. But as I mentioned before, when we move to the final product, if there are other questions, if you think of something else about Gonolf, feel free to jump in there. Kaitlyn will get to everything that you have, but we'll give another 30 seconds or so if people have any questions they might be thinking of before we move on to the next product.
Great. Another thing I like to mention with the Gonolf pen, and I did touch on this with the multi-use vial about storage and expiration and things like that. So a few good rules of thumb here. When you get your medication, if it's the pen, you will need to put it in the refrigerator as soon as you get it. And the reason being, as long as it's refrigerated, it is good until its expiration date. Now, say you forget to put it in the refrigerator, the pen's reached room temperature, you haven't used it yet, but it's definitely room temperature. That's okay, but keep in mind that it's good for 3 months at that point. Putting it back in the refrigerator won't make it prolonged to the expiration. Just go ahead and leave it at room temperature at that point. Just know that you have 3 months from that point. Now, once you've used the pen for the very first time, whether it's been in the refrigerator, whether it's at room temperature, it's good for 28 days or until the expiration date, whichever comes first there. So keep that in mind. Once you've used the pen for the first time, you can put it back in the refrigerator, you can leave it on the counter. Whatever is easier for you, whatever will help you remember to take your medication at whatever time of day you're meant to take it, that's what I recommend. Another tip that I tell my patients, depending on the situation, maybe it reached room temperature before you've got a chance to use it for the first time. You can write with a Sharpie on the pen what date it reached room temperature, or if you just want to write your new expiration date on there, if you want to do the math early, that's perfectly fine too. And then same thing, once you've used it for the first time, you know you have 28 days. So put the date which it expires. That way, you know, it's not pushing close to that date and you're like, oh, I can't remember if it was this day or that day. You can just write it on there and then you'll know exactly when things expire and if you need to refill.
Thank you. That's a great pro tip right there, and appreciate that, sharing that out there for everybody. So right now it looks like we have wrapped up. So we're going to get ready to move on. So if you want to introduce the next product, we can get ready to roll to the next one.
Now we will review how to use a Centerra patch. The patches will likely come in packages such as this. So I recommend just gathering your supply there and deciding what site you want to use. Now, the patch does need to be applied directly to the site that you plan on doing an injection, and it does need to be applied about 20 to 30 minutes prior to your planned injection. You'll take your patch out of the packaging. This is the top of the patch, so when it's on, this will face outside, and then the sticky part is here, and there is a plastic film over it that you'll need to peel off. So it comes apart like this. And this does need to be applied to skin that is unopened and clean. So if you have residual tenderness or scabs, I wouldn't recommend putting this over that skin. I would find a fresh new site. And then after that, you just apply the patch to the skin. Make sure it's flush against the skin. You do want to make sure to not cover up this outside part where it has these little vented holes. That's how the patch begins to do its magic. So when it's on, it'll actually feel kind of warm, and that means it's just increasing that blood flow in order to kind of absorb the medication even quicker. Once you have it on for 20 to 30 minutes, you can peel the patch off. And then prep the site for your injection. And that's how you use the Centerra patch. Okay, so that was the Centerra patch. Now, one thing I did forget to mention, once you have used the patch, it's been on for 20 to 30 minutes, be sure to definitely remove the patch. I've heard of times that we've had patients that actually give the injection through the patch. You don't want to do that. Take it off. It's done its job. You don't need it anymore. Once you take it off, you can actually just stick it right onto the packaging that it came in, because when you expose that sticky side, you're exposing the medication. So just good practice to stick it onto the foil packet it comes in, and then go ahead and dispose of it that way. Do we have any questions coming in yet, Craig?
Yes, actually, one that just came out, and we've this one we get all the time, so you're probably a pro at answering this question, and relates to what you were just talking about taking it off when you're done. A couple of times it came in, is it possible to overdose on the medication if I leave the patch on for too long?
So typically it's not going to hurt anything if you leave it on for more than the 20 to 30 minute recommendation, but keep in mind that's all it needs. So I usually tell my patients, set a timer for yourself, 20 to 30 minutes, you know, whichever way you want to go, depending on when your injection's supposed to be and timing and that sort of thing. That way, not only are you getting a reminder to remove the patch, but you're also getting a reminder to do your injection. So you're kind of checking both things off your list. Like I said, if you leave it on for longer than it's intended, it's okay. But ultimately, you know, no need to overkill here. It's going to do its job in that quick 20 to 30 minutes.
Perfect. Thank you so much for putting people at ease there. So another question that came up, and you actually referred to this a little bit, tie it back to the Gonolf pen, about utilizing Centerra Patch a lot of times for like intramuscular injections. And so somebody wrote in, a friend of mine said that she used it before actually just for giving blood. What other things can I use Centerra for? Is it wrong? Am I using it off label?
So great question. Typically the official answer is going to say, use it for what your prescriber intended it for, right? But typically, if you have a particular procedure that you're undergoing, I would just run it by your nurse. They can confirm that for you. For my patients, I know that I recommend it, especially for those that have a fear of needles, for not only their IVF injections, but also the blood draws. So very similar to that question of a friend that was giving blood. So during IVF stimulation cycles, during those frequent monitoring appointments, you're getting a bunch of blood drawn. So I recommend it for patients for that maybe that's uncomfortable for them, or they have a fear of needles. You can definitely use it for those appointments. Also, once you get to the retrieval procedure of your IVF cycle, it's likely you're going to have an IV that day. So that's another great option for the discomfort of getting an IV placed, or if you have a fear of that. So the official answer, run it by your nurse, run it by your provider, make sure that they agree. But typically you can use it, for things outside just your personal injections. So different appointments and things where you might be getting poked. It's perfectly fine.
Great. Thank you very much, Kaitlyn. And so another question comes in here that says, last time I used the Centerra Patch, I saw some redness. Does that mean that I did something wrong?
Oh, no, not at all. So the redness is very common with the Centerra Patch. So when the patch is kind of doing its job, if you will, it heats up. So it can actually cause the skin to kind of redden in color. Also, sometimes adhesives can cause some redness. So it may not just be in the first time you use the patch, but with repeated use, sometimes that can cause a little bit of irritation too. Typically though, both of these things will dissipate after you've removed the patch. So as long as you aren't getting any type of like allergic type reaction, difficulty breathing, hives spread throughout the body, things like that, then this redness is a very normal finding.
Perfect. Thank you. So this question just popped up on Zoom, and the question is, so I think it's based on something you were just talking about injections, because it says, so am I correct that I can't put the patch on an area that I previously injected on?
So kind of twofold answer. So you can, what I recommend doing with your injections is rotating sites. So if you are doing like intramuscular injections in the hip booty area, I recommend doing one side one day, then rotating to the next side the next time you need to do injections. If it's a little tender from a previous injection, you can still do the same area. But if you, for any reason, have like active openings of the skin or scabs, I wouldn't put the adhesive on it. I would find a new site. But usually rotating the skin areas from day to day with your injections helps to give that skin a break, time to heal, and then makes it kind of eligible again, if you will, to use the patch. So technically speaking, yes, you can reuse sites and put the patch on a site you've already used, as long as it's healed over and you don't have any open wounds on the skin at all. That's a really good question.
Thank you. That was a great answer as well. Thank you very much, Kaitlyn. So a question here that has come up before. You mentioned about the idea of letting it breathe. Mm-hmm. So the question comes in, what happens if I cover it too much by mistake? Do I have to worry about leaving it completely uncovered, or is like a long sleeve shirt or, pants or something like that, long sleeve shirt on an arm, something like that, is that going to be enough?
Yes, good question. So if the patch is completely compressed and air can't get to it, then it just may not do its job as well. So it may not take full effect. If that does happen, you can go ahead and give your injection. It just may not be as numb as maybe previous times that you've used the patch. The other option would be to leave the patch on for a little bit longer with it completely open to air, give it a little bit more time to kind of do its magic, if you will. Keep in mind, if you're doing a super time sensitive, like a trigger shot injection for your cycle, and maybe you didn't let the patch get all the air it needed, I would not delay that injection to let the patch take hold longer by leaving it on longer. Your timed injection is much more important, and it's likely that the patch will still have some effect, just maybe not as much as previous times using it. For the piece with the long sleeves and the pants, as long as it's not super tight clothing, it should be okay. I would just err on the side of caution, just let it breathe completely open. But if you have like a free-flowing shirt, that should be enough circulation for air to reach the patch.
Thank you so much, Kaitlyn. I appreciate it. And I know that's a question I think sometimes people don't really understand exactly how things are working. We've gotten that question earlier, like, hey, what is Gonolf doing or whatever. So it's good for people to really understand how is the Centerra Patch working and why, so that you can get the result that you're looking for, which is to minimize any issues and make your entire cycle injection process smooth and easy. And that's what we're all about here. So thank you for helping with that, Kaitlyn. As of right now, we have gotten to the end of the questions that are in as it currently stands. We know we have a little bit of time left, so we want to give people some time. If you do have any questions, it doesn't have to just be about Centerra or honestly even about Gonolf at this point. If you do have questions about anything as relates to a product that you're taking, feel free to jump in and Kaitlyn will try to help you out right now. But we definitely appreciate everyone who has joined in and with the great questions so far, and we'll give you a little bit of time to throw a few more questions out. So I'll kick it over back to you, Kaitlyn, in the meantime.
Great. So like I said, remember to take the patch off before your injection. Now, if you accidentally do it, it's okay, but that's just more work. So remember to take that patch off before you give your injection. Another thing with this patch, don't be shy to ask for this, right? Like Craig said, this is something that can just kind of take the edge off a little bit of this process. This IVF and fertility experiences are very emotional and taxing in many ways. So this is definitely something that's just one more less thing you have to think about, is probably the better way to phrase it. It's there for you to try. So don't be shy to request this, give it a shot. I think that, I don't think I've ever had a patient that regrets trying it out. So there's something. But there's not a lot of things that we can always control in these medications and having to give injections, but the Centerra Patch is one thing that gives us a little bit of control. So I think that that's always a good feeling. Anything else, Craig?
I think we are all caught up right now, so I will turn it back over to you to start to wrap things up. Thanks again.
Great, no problem. So again, any last minute questions, go ahead and shoot them on over. Otherwise, thank you all so much for joining this evening. I hope that these tips and videos have helped calm the nerves of doing IVF injections and given you some confidence with these medications. Remember, if you need to either review this live stream again, or if there's other medications that maybe we didn't cover tonight, they will be located at mymandelsPharmacy.com/pharmacist. So like I said, this entire video, also the smaller instructional only videos are there. So be sure to review those as needed. Thank you all again, and I hope everyone has a great week.
Thank you so much, Kaitlyn. I just want to thank you for your time and your expertise tonight. You did, as always, an amazing job, and you were able to share some of your own personal little tips for everyone throughout the course, so we appreciate that. And I do also want to thank everyone who joined us tonight via Zoom or Facebook Live for sharing your excellent questions and for allowing Kaitlyn to share her expertise with you. We hope that you were able to learn something new tonight that's really making you a little bit more comfortable as you get, if you're getting closer to taking shots, or if you're already in the midst of it, something that just smoothed out the process and made it a little bit easier for you. That's really what we're here for. And we also, as Kaitlyn had said, we never want you to forget that all the entire videos, the full virtual learning experience videos, or VLEs, as well as those individual little product demonstration videos, you can find them on demand at our YouTube page, our Facebook page, and at mymandelsPharmacy.com/pharmacist. You can go in there and actually search and just look for the specific products you're looking for. Or you can go on and just watch these entire videos where you get the benefit of all the Q&A that was asked as well. We look forward to seeing you all here again next Monday night at 7 p.m. EST for another great program. Our goal is every Monday night to have these here for you. And really what we're trying to do is provide a forum where you can ask those questions that you have, especially in these times where maybe you're not getting face-to-face as much as you'd like, to be able to ask those questions. And B, also just put to rest any concerns that you have and make sure that you are a pro by the time you're ready to get your next shot. This is not a difficult thing for you at all. So thank you again. Please share that Pharmacist program with anyone else that you feel can benefit from it, whether it's a friend going through it or a family member. If they don't know about it, this is the best way for them to find out is from you. So we want to say thank you again for everything. Thank you, Kaitlyn. Thank you, Mandels. And thank you, everyone, for joining us. And good night.